Recognizing the symptoms of poor nutrition is crucial for maintaining overall health. The body is excellent at sending signals when it's not getting the right nutrients. Here is a comprehensive list of symptoms, categorized by how they manifest in the body. Physical symptoms and AMP signs. Constant fatigue and low energy. What it feels like. You get enough sleep but still feel drained, sluggish, and lack the energy for daily tasks. Why it happens. This is often linked to insufficient calories overall, or a diet low in key nutrients like iron, leading to anemia, B vitamins, and complex carbohydrates, which are the body's primary fuel source. Changes in hair, skin, and nails. Hair becomes dry, brittle, and may fall out more than usual. It can also lose its shine. Skin may become dry, flaky, itchy, or develop rashes. Poor wound healing and easy bruising can also be signs. Nails become brittle, develop ridges, or break easily. Why it happens. These tissues are some of the first to show deficiencies in protein, essential fatty acids, vitamins A, C, D, E, and minerals like zinc and iron. Digestive problems. What it feels like. Frequent constipation, diarrhea, bloating, or gas. Why it happens. A diet low in fiber, from fruits, vegetables, and whole grains, and fluids is a primary cause of constipation. An imbalance of gut bacteria can also result from a diet high in processed foods and low in fermented foods and prebiotics. Unexpected weight changes. Weight gain. Steady weight gain can result from a diet high in ultra-processed foods, sugary drinks, and large portion sizes, which are calorie-dense but nutrient-poor. Unintentional weight loss. Losing weight without trying can be a sign you're simply not eating enough calories or nutrients to meet your body's needs. Getting sick frequently. What it feels like. You catch every cold and flu that goes around, and it takes you a long time to recover. Why it happens. A weakened immune system is a classic sign of poor nutrition. Key nutrients for immunity include vitamin C, D, E, zinc, and protein. Poor dental health. Signs. Bleeding gums, loose teeth, and dental cavities. Why it happens. This is directly linked to high sugar consumption and the lack of vitamin C, for gum health, and calcium, for tooth strength. Mental and AMP, emotional symptoms. Brain fog and poor concentration. What it feels like. You have trouble focusing, remembering things, or thinking clearly. Why it happens. The brain needs a steady supply of glucose, from complex carbs, healthy fats, like omega-3s, and vitamins like B12 and folate to function optimally. Blood sugar spikes and crashes from a high sugar diet can severely impact focus. Mood swings and irritability. What it feels like. You feel snappy, anxious, or unusually low for no clear reason. Why it happens. Diets high in sugar and processed foods are linked to inflammation and blood sugar instability, which can disrupt neurotransmitters in the brain that regulate mood, such as serotonin. Cravings. What it feels like. Intense, specific cravings for sugary snacks, salty foods, or refined carbs. Why it happens. While sometimes a sign of dehydration, cravings often indicate a nutritional imbalance. For example, craving sugar can be a sign your body is looking for a quick energy fix because it's not getting sustained energy from balanced meals. Specific nutrient deficiency signs. Iron deficiency, anemia, extreme fatigue, weakness, pale skin, shortness of breath, dizziness, and cold hands and feet. Vitamin D deficiency, fatigue, bone and back pain, low mood, and getting sick often. magnesium deficiency, muscle cramps or twitches, trouble sleeping, and irritability. Vitamin B12 deficiency, numbness or tingling in hands and feet, fatigue, brain fog, and weakness. What to do if you experience these symptoms? Don't panic. Experiencing one or two of these symptoms occasionally is normal. It's when they become a persistent pattern that you should pay attention. Consult a healthcare professional. The most important step is to talk to a doctor or a registered dietitian. They can help rule out other medical conditions and provide personalized advice. A simple blood test can identify common deficiencies. Start a food diary. Track what you eat for a few days. This isn't about judgment, but about awareness. You might spot patterns, like relying heavily on processed foods or skipping vegetables. Focus on adding, not restricting. Instead of thinking about what to cut out, think about what you can add in. Add one more vegetable to your lunch and dinner. Swap white bread for whole grain. Include a source of lean protein, chicken, fish, beans, lentils, with each meal. Snack on fruit, nuts, or yogurt instead of chips or candy. Drink more water throughout the day. Listening to your body's signals is a powerful tool for health. By paying attention to these symptoms, you can make positive changes to your diet that will improve your energy, mood, and overall well-being.